Good morning. I'm Dr. George Springer. We're going to talk a little bit about asthma today. Asthma is something that plagues obviously millions of people. And the current approach is to use some kind of medication to control symptoms or chase after those symptoms in a way that allows people to get on with their lives, which is good. So this doesn't allow people to get to the cause of why people have asthma to begin with. Here at LifeWorks, we have a tendency to look at cause. That's one of the big things we do. We want to look at the cause of why people are having issues. And so what we'll do with in the case of asthma is we'll start looking at it, of course, being an immune system issue. Now, immune system right away tells us that we need to look at the digestive system because 80% of the immune system is in the gut. So if the gut is not happy, it's going to cause all sorts of immune system issues, all the way from asthma to allergies and a whole host of other kinds of things. But fixing asthma, it really entails looking at what's going on digestively to a large degree first. Once you look at the gut, you also then look at other kinds of combinations of things that tend to exist, like are things in the large intestine? Because in Chinese medicine, there's a relationship between what goes in the large intestine and the lungs. Those acupuncture meridians are paired, so sometimes burdens on the colon will be reflective in the lungs. One of the other things we look at is what's going on with the adrenals. Many of the asthma medications uses epinephrine. Epinephrine is a neurochemical produced by the adrenals that actually bronchodilates. It opens up the bronchioles. Well, it stands to reason then, if that's the case, that works, that you maybe look at your own adrenals to get them in better shape so they're producing the right levels of epinephrine in your body. 85% of the epinephrine comes from the adrenals, and so subsequently it has a big effect on making sure that your lungs are functioning correctly along with other things in the body. Occasionally, we end up with fungal infections in the lungs as well. These are small infections that sometimes are overlooked, and then many times individuals are not aware are there. I've had several cases of fungus in the lungs when resolved with some of the things that we do. Individuals' asthma and the lung problems they've had for decades have actually cleared up. So those are some additional things to think about with asthma, and appreciate you tuning in. Thanks.